Hello everyone. Today, we're going to dive into an essential topic in pharmacology, selective serotonin reuptake inhibitors, or SSRIs. These are one of the most commonly prescribed medications for mood disorders. Let's explore how they work, their uses, and potential side effects. SSRIs are second-generation antidepressants. They primarily work by increasing serotonin levels in the brain, which helps regulate mood. These medications target the central nervous system and are widely used to treat mood disorders such as depression and anxiety. Examples include sertraline, fluoxetine, citalopram, escitalopram, and paroxetine. Serotonin plays a critical role in regulating mood, sleep, appetite, and cognition. Low levels of serotonin are associated with depression, anxiety, and other mood disorders. By enhancing serotonin activity, SSRIs address these symptoms effectively, providing relief to millions of patients. Serotonin is released from presynaptic neurons into the synaptic cleft. It binds to serotonin receptors on the postsynaptic neuron to exert its effects. Excess serotonin is reabsorbed into the presynaptic neuron via the serotonin transporter for recycling or degradation. SSRIs block the serotonin transporter. This prevents the reuptake of serotonin into the presynaptic neuron. The result is an increase in serotonin concentration in the synaptic cleft, enhancing its availability to bind to receptors on the postsynaptic neuron. Let's look at the pharmacokinetics of SSRIs. They are well absorbed from the gastrointestinal tract and highly protein-bound, primarily to albumin. Most are metabolized in the liver by cytochrome P450 enzymes, with some variations depending on the drug. For example, fluoxetine is metabolized by CYP2D6, producing an active metabolite called norfluoxetine. Importantly, SSRIs have long half-lives, which supports once-daily dosing. For instance, fluoxetine has a half-life of 4 to 6 days, while its metabolite's half-life extends to 7 to 15 days. SSRIs are versatile and used in a range of conditions. They're the first-line treatment for major depressive disorder and are also effective for generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, social anxiety disorder, and post-traumatic stress disorder. Their broad applicability makes them essential in psychiatric care. While SSRIs are generally well tolerated, they do come with some side effects. Common ones include gastrointestinal disturbances, such as nausea and diarrhea, as well as sexual dysfunction, sleep disturbances, and weight changes. Rare but serious side effects include serotonin syndrome, which can occur with excessive serotonin activity, and hyponatremia, particularly in elderly patients. It's crucial to monitor patients and educate them about these risks.
Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content about health and medicine.